my name is Noelle, and the disease I decided to research is diphtheria. Diphtheria is an infection caused by the bacterium Corynebacterium diphtheriae. It's a non-endospore-forming gram-positive club-shaped bacteria. It's very rare and it's no longer common today. The bacteria attaches to the lining of the respiratory system, including parts of the body that help you breathe. When this occurs, the bacteria produces a toxin that destroys healthy body tissues. The bacteria may also get into your bloodstream and cause harm to your heart, your kidneys, and your nerves. Within 2 to 3 days, the dead tissue forms a thick gray coating that builds up and can cover tissues in the nose, tonsils, voice box, and throat, making it very hard to breathe and swallow. Some signs and symptoms of this disease is a thick gray membrane covering the throat and tonsil, difficulty breathing, severe weakness of the body, sore throat, fever and chills, swollen glands of the neck, and sometimes nasal discharge. This disease has an exotoxin, diphtheria toxin. This toxin inhibits the cellular protein synthesis. It's responsible for destruction of healthy body tissues and pseudomembrane formation. It usually occurs around the age groups of preschool children, and it's around the autumn and winter season is when this disease can be contagious. The transmission of this disease is usually spread from one person to another by respiratory droplets. That's usually coughing or sneezing. It's very rare, but the disease can also be spread through open sores or clothes of the contaminated person. In babies and children, the contact of objects like toys, for example, that have the bacteria can also cause diphtheria. The culture is usually gray and black colonies, club-shaped on a tellurite medium. Doctors can swab the back of the throat and test if you have the disease, but sometimes, since this disease is really contagious and sometimes life-threatening, it's better to get treatment right away. Doctors can also identify this disease by common symptoms, especially sick children who have sore throat with gray matter forming on the tonsils and throat, like this picture, for example. This is gray matter, and if this gray matter keeps building up, then it's going to cause difficulty breathing in the future. Physicians can also take a sample of tissue from an open wound and have that tested for a type of diphtheria that affects the skin, called cutaneous diphtheria. Alright. Prevention of this disease is usually taken by 4 vaccinations. They're called DTaP, Tdap, DT, and TD. The DTaP is for young children, Tdap is for preteens, and TD is for adults. Since the introduction of this effective immunization, starting in the 1920s, diphtheria rates have dropped dramatically. It's very rare to get this disease. Fun fact, DTaP and Tdap also help prevent pertussis, which is whooping cough. Treatment for this disease. Patients with this disease must be isolated to prevent others who are not immunized against this disease. The diphtheria antitoxin is produced in horses. This antitoxin helps neutralize the diphtheria toxin already circulating in the body. Some may be allergic to the antitoxin, so they must be desanitized, then given small doses of the antitoxin, and then gradually increased dosage. This disease is also treated with antibiotics such as penicillin and erythromycin to help kill the harmful bacteria.